What if your liver is quietly crying for help, and you have no idea? Liver disease is called silent for a reason. By the time symptoms appear, damage may already be serious. But here's the shocking truth: up to 1 in 3 people worldwide already have liver problems, and most don't even know it. That's nearly 30% of the global population, living each day with a struggling liver. In this video, I'll walk you through the 14 warning signs that your liver needs attention, signs you should never ignore. I'll also reveal the real causes behind modern liver disease, and give you 6 proven, science-backed steps to prevent it. And yes, we'll talk about food, specifically, which ingredients heal and which ones silently harm your liver. Most people think alcohol is the main enemy. It's not. Today, the leading cause of liver disease is something far more common: non-alcoholic fatty liver, driven by processed food, sugar overload, sedentary habits, and hidden inflammation. Even over-the-counter painkillers like acetaminophen or viral infections such as hepatitis A, B, or C can do long-term harm. So why is your liver so important? This organ quietly works 24/7, filtering toxins, balancing blood sugar, producing 70% of your cholesterol, making bile for digestion, and keeping your blood clotting properly. It's your biochemical command center. But when the liver starts to fail, everything from energy levels to hormones to digestion falls apart. That's why understanding the early signs, and acting fast, can literally save your life. Let's dive into the signs, the science, and the solutions, before it's too late. 1. Reduced vision, especially at night. Have you ever found it harder to see clearly in the dark, even when your eyes used to adjust just fine before? This isn't always an issue with aging or your glasses. It could be a subtle sign that your liver is struggling. Reduced vision, especially at night, is one of the lesser-known but important indicators of impaired liver function. This happens partly because your liver plays a key role in absorbing and storing vitamin A, which is essential for healthy vision, particularly in low-light conditions. When liver function declines, vitamin A absorption decreases, which directly impacts how well your eyes adapt to darkness. But there's more. Liver issues don't just affect vitamin levels, they can also impair overall visual acuity, making your eyesight blurrier or less responsive over time. People often first notice this at night: difficulty walking in a dark hallway, trouble adjusting to dim lights, or poor depth perception after sunset. These symptoms can creep in slowly and be brushed off as fatigue or screen strain. But if your night vision is getting worse, it may be your liver trying to tell you something. Don't ignore it. 2. Zanthalasma. If you've ever noticed small yellowish patches near the corners of your eyelids, or around your eyes, you might be tempted to dismiss them as a cosmetic nuisance. But these spots, called xanthalasma, can be a visual cue that your liver, and your cholesterol levels, are out of balance. Zanthalasma occurs when cholesterol builds up under the skin, and while it's often associated with lipid disorders, there's a strong link to liver dysfunction as well. Here's why: about 70% of the cholesterol in your body is produced by your liver. When the liver is under stress or not functioning optimally, it can lose control over cholesterol regulation, leading to increased circulating fats and visible deposits like these. So what looks like a harmless yellow patch can actually be a systemic red flag. Liver function needs to be evaluated, especially if xanthalasma appears alongside other symptoms, such as fatigue, abdominal bloating, or changes in stool or urine color. While these patches themselves are not dangerous, they're often a symptom of a deeper metabolic imbalance, and your liver may be at the center of it. 3. Dark urine. You may not think twice about the color of your urine, but sometimes, your body gives you clear visual messages. and this is one of them. If your urine starts to look unusually dark, almost the color of cola or strong tea, this could be a sign of liver dysfunction. While dehydration or intense exercise can temporarily concentrate urine, what we're talking about here is something more persistent and striking. Many patients describe it as soda-colored urine. This isn't just about fluid levels, it's the result of bilirubin, a substance your liver processes. When the liver becomes inflamed or damaged, bilirubin can leak into your bloodstream and get excreted through urine, giving it a much darker hue. This condition is known medically as coluria, and it often appears alongside other symptoms like yellowing of the eyes or skin, jaundice, pale stools, or fatigue. If you notice this change and it doesn't go away after hydration or rest, don't assume it's nothing. It's time to get your liver checked. 4. Drowsiness. Do you find yourself falling asleep during the day, struggling to stay alert, or experiencing a foggy mind even after a full night's rest? While drowsiness can be caused by many factors, persistent daytime sleepiness may be a subtle sign that your liver is no longer filtering toxins efficiently. One of the liver's most vital roles is detoxifying your blood. When it begins to fail or gets overloaded, toxins like ammonia can start to accumulate in your system and even reach your brain. This can manifest as mental confusion, low energy, and an overwhelming urge to sleep, symptoms that can escalate to a more serious condition called hepatic encephalopathy if left unchecked. While we won't go deep into hepatic encephalopathy in this video, it's important to note that even early-stage liver problems can alter your mental sharpness and energy regulation. You may notice you're sleeping more, struggling to focus, or simply not feeling mentally present. Don't dismiss it as just stress or age. If this drowsiness is new, unexplained, or getting worse, your liver could be the underlying reason, and early testing could prevent more serious complications. 5. Pain in the right side of the abdomen. It's located in the right hypochondrium, just below the ribs on the right side. Got it? Why? The liver can sometimes cause pain when inflamed, for example. It can be painful not just when touched, but many patients report pain in that area. This pain can also spread to the right shoulder. So many patients also experience right shoulder pain. Interesting, isn't it? You can see how many of these signs and symptoms are surprising. Who'd think right shoulder pain could signal liver problems? 6. Telangiectasias, spider veins. If you notice small, web-like red veins on your chest, face, or arms, don't ignore them. These spider angiomas can be an early sign that your liver is in trouble. The liver helps clear excess estrogen. When it's not working properly, estrogen builds up, especially in men, disrupting the balance with testosterone. This can lead to gynecomastia, or male breast enlargement. So if you see unusual veins on your skin or notice changes like swelling in the chest, it's time to check your liver health. Sometimes, your skin shows the warning before anything else does. 7. The opposite extreme. Just as it can cause bleeding, liver changes can also increase your risk of thrombosis or blood clots, like deep vein thrombosis. Why is this situation particularly dangerous? These clots in deep veins can travel to the lungs, causing a serious condition called pulmonary embolism. Many people get tested even for cancer, which also increases thrombosis risk. Many screen for cancer but actually have a liver problem. Remember I mentioned swelling and people checking kidneys and heart? Similarly for thrombosis, other diseases are screened, but the liver is often overlooked. The liver plays a role in coagulation factors and the coagulation cascade. So it's crucial to evaluate liver function as well with thrombosis. It's important to always try to determine a cause. Okay, if you had deep vein thrombosis in your leg, try to understand why it happened. Were you immobilized, bedridden, or did you have surgery? Are there any changes? Were you taking any medication that could increase your risk of thrombosis? If there's no obvious cause, investigate other issues like liver problems. 8. Bruising or uncontrolled bleeding, like nosebleeds. You notice wounds take longer to stop bleeding, as liver issues can affect clotting. They can alter platelet levels and other clotting factors. Another test, prothrombin time, is directly linked to our blood clotting. Remember I mentioned that one of the liver's functions was producing clotting factors? So liver problems can cause these symptoms, like frequent bruising. Bruises, not the kind from bumping into a table, which you'd expect to turn purple. You know where that came from, right? This is different. You have multiple bruises but can't explain where they came from. Often, these bruises are quite large, or you start having nosebleeds when you never did before. In these cases, liver problems should be investigated. 9. Water belly, known as acites. You've seen that legs can swell, right? Well, fluid can build up in other areas too. I want to highlight acites, which is fluid accumulation in the belly area. It can occur elsewhere, but let's focus on the belly. It can also affect the lungs, called water in the lungs or pleural effusion. Have you heard that term before? So liver problems can cause this as well. Ascites is most commonly seen in advanced liver disease like cirrhosis. It happens because portal hypertension and low albumin levels disrupt fluid balance, allowing fluid to leak into the abdominal cavity. In some cases, paracentesis, a procedure to remove excess fluid, is needed to relieve discomfort and pressure. 10. Swelling. We've seen that liver issues can alter albumin and body proteins, causing swelling, mainly in the legs, but also elsewhere. Sure, swelling has other causes, like heart or kidney problems, but liver issues are often overlooked. People usually investigate other causes while the liver's role is ignored, even though it's causing the swelling. This swelling, known as peripheral edema, is often symmetrical and painless. It tends to appear in the ankles and feet, especially after standing for long periods. If left unchecked, this fluid retention can progress and combine with ascites, making liver disease more difficult to manage. 11. Fatigue. Fatigue, why? Our liver is vital for our life, and one of the most common signs is fatigue. That extreme tiredness where you struggle to get up, find it hard to do physical activities. And also, our liver is crucial for protein production, so a liver problem can lead to a condition called low albumin or hypoalbuminemia. I'm using several technical terms in this video, which I don't usually do, but it's important you understand. So as I'm speaking, I'm also explaining to make it clear. Okay, so liver issues can cause fatigue. You need to check it out. It's often one of the first signs to appear. 12. Itching. Due to increased bilirubin and other toxins, the liver filters toxins. If impaired, higher bilirubin levels can cause itching. From my experience working in emergency and inpatient care, I've seen many patients with liver issues. Itching is a key symptom, but many patients only mention it when asked directly, often thinking it's something else. They say, "I'm itchy, but I must have an allergy," or "I ate something spoiled or didn't sit well," when really you should check for liver issues, as it could be one of the signs. 13. Yellowing, also known as jaundice. Why? When we have liver issues, our bilirubin can rise and accumulate in our skin and eye tissues, causing yellowing, making the skin appear more yellow. It usually starts in the eyes, the first place people notice. Even lower levels can cause this sign in the eyes. It then progresses and may spread to the body. 14. Pale stools, known as aeolia. Stools become whitish because, as we've seen, the liver produces bile. When there's a liver problem, one of the signs is that stools become whiter or take on a pale, whitish color. In medical terms, we call this aeolia. You should also pay attention to your stool color. So, how can you protect your liver before problems begin? Let me walk you through 6 powerful, science-backed steps that can reduce your risk, support liver repair, and potentially add years to your life. Stay with me to the end, because the food list I'll share could make all the difference. Step 1. Get vaccinated. Yes, some of the most damaging liver diseases are caused by viruses, especially hepatitis A and B. Hepatitis A spreads through contaminated food and water, known as the fecal-oral route. Hepatitis B, on the other hand, spreads through blood and bodily fluids. Both can cause lifelong liver damage. Getting vaccinated is a simple but essential step. Check your vaccination status. Have you had yours yet? Step 2. Ditch ultra-processed foods. I'm talking about those freezer aisle regulars, frozen pizzas, instant noodles, packaged snacks, sausages, canned meats. These foods are loaded with preservatives, industrial fats, and hidden sugars that contribute to non-alcoholic fatty liver disease, now the #1 cause of liver damage globally, even surpassing alcohol. Make it your goal to cook more meals from scratch. Want a burger? Great, make it at home with lean meat and ingredients you can trust. The phrase to remember here is, peel more, unwrap less. Homemade doesn't just taste better, it helps your liver heal. Step 3. Say no to high fructose corn syrup. It hides in so many processed foods, sweetened drinks, sauces, even bread. This syrup directly contributes to fat buildup in the liver, inflammation, and insulin resistance. Read your labels carefully. If it contains corn syrup or fructose syrup, put it back. Step 4. Avoid crash diets. Losing weight is good, but losing it too fast? That's dangerous for your liver. Rapid weight loss can lead to necrosis, or death of liver cells. So forget the only drink tea or just eat boiled eggs for a week diets. The American Liver Foundation recommends losing no more than 1 to 2 pounds per week, slow, steady, and sustainable. Diets like the Mediterranean diet, rich in vegetables, olive oil, legumes, fish, and whole grains, have been shown to protect liver function long-term. Step 5. Cut alcohol completely. There's a common myth that 1 drink a day is harmless. But if your liver is already inflamed or fatty, even small amounts of alcohol can accelerate damage. 0 is the safest option. And even if your liver is healthy now, skipping alcohol reduces long-term risks across the board, from fatty liver to cancer. Step 6. Fill your plate with anti-inflammatory foods. Here's your shopping list: garlic, red grapes, with skin, onions, broccoli, cucumber, guava, strawberries, green tea, turmeric, ginger, avocado, dark chocolate, up to 30 g daily, and extra virgin olive oil, around 7 milliliters per day. These foods help lower inflammation, regulate fat metabolism, and support liver regeneration. And don't forget coffee. Studies show up to 3 cups a day can reduce liver fat and fibrosis. Also, apples and seeds like chia, flax, and pumpkin bring in fiber and antioxidants your liver loves. Just following these 6 steps can dramatically shift your liver health in the right direction. It's not about perfection, it's about daily choices that build a strong, resilient body from the inside out. So take care of your liver, it takes care of you every second of every day. Now you know, the liver doesn't just detox your body. It powers your digestion, balances your hormones, regulates your cholesterol, and even keeps your blood from clotting or bleeding too much. But when it's in trouble, the signs often show up in surprising ways: itchy skin, swollen legs, dark urine, chronic fatigue, or even changes in your vision. These aren't just minor symptoms, they're your body's way of saying, "Hey, I need help." The good news? Liver disease can often be prevented or even reversed with simple steps. Stay away from ultra-processed foods, avoid sugar-loaded syrups, cut back or eliminate alcohol, maintain a healthy weight without crash diets, and fill your plate with anti-inflammatory, liver-loving foods like garlic, avocado, broccoli, olive oil, and green tea. Your liver is incredibly resilient, but only if you give it the care it deserves. So pay attention to the signs, listen to your body, and make changes before it's too late. If you found this video helpful, don't forget to hit the like button, share it with someone you care about, and subscribe to the channel so you never miss out on vital health information that could one day save your life. Thanks for watching. Take care of your liver, and it will take care of you. See you in the next video.